Many people don't understand the difference between a psychologist and a psychiatrist. And there's a really clear thing that differentiates the two of these professions. So I wanted to take some time to create this video to help you clearly understand the difference. My name is Dr. Scott Giacomucci, and I'm a clinical social worker and trauma therapist. And I spend a lot of time working with both psychiatrists and psychologists. They have much in common, and their fields are intimately connected, psychiatry and psychology. And I think because they're so connected, because they have so much in common, and because the name of their profession sounds so alike, it leads to some confusion in how they're different. So the primary difference between a psychologist and a psychiatrist is that a psychologist is going to focus more on treatment for mental health issues through psychotherapy, whereas a psychiatrist is going to focus more on treatment through medication. So a psychiatrist has a medical degree or DO, and a psychologist holds a PhD and sometimes a PsyD, so a doctorate in psychology. So you can quickly tell the difference between a psychiatrist and a psychologist by looking at the letters after their name. If the professional has an MD or DO after their name, then that would indicate that they're a psychiatrist. If the professional has a PhD or PsyD, PSYD after their name, then that could indicate that they're a psychologist. So even the schooling and training for these professions are a bit different. A psychologist ends up getting more experience conducting research about psychotherapy or psychology or personality or mental health. And so a psychologist in their doctorate program is almost always going to have to conduct some sort of research study for their dissertation, especially if they're in a PhD program compared to a PsyD program. And a psychologist can usually complete their degree in about 5 years, and then they have 2 years of supervised practice in most cases, although this may vary state to state, before they can get licensed in their state. On the other hand, a psychiatrist is completing a medical degree or a osteopathic degree, a DO, and most of the time they're not conducting research in graduate school. Their degree is more focused on practice. They're usually not going to be doing research, and they can complete their medical degree in about 4 years, but then they have to do a 4-year residency, which is like a intense internship before they're done with the foundation of their training and able to get licensed. But most of the time they're going to also do additional training, postdoctorate fellowships in order to get specialization and pursue board certifications. So both a psychologist and a psychiatrist have pretty intense training and schooling. However, a psychiatrist's training and education is a bit longer than a psychologist's. Now, historically, psychiatrists used to do a lot of psychotherapy, and originally all of the founders of the field and models of psychotherapy were all psychiatrists. However, over time, the field has changed considerably, and psychiatrists primarily only prescribe medication nowadays. It's actually difficult to find a psychiatrist that does psychotherapy for more than 15-minute sessions. And nowadays, most psychotherapy is being conducted by clinical social workers like myself, or by psychologists or counselors or marriage and family therapists. So if you're looking for someone to prescribe medication, then what you're looking for is a psychiatrist. A psychiatrist is someone who specializes in psychopharmacology and in medicine and mental health. So psychologist cannot prescribe medication, but a psychiatrist spends usually all day, every day, prescribing medication, doing check-ins and medication tweaks. Most of their work is going to be focused around assessment and medication. However, if you're not looking for medication and you're looking for psychotherapy, then what you really want to be seeking is a psychologist or a clinical social worker or a counselor. So In a future video, I'm going to outline the difference between a clinical social worker and a counselor. So if you're curious about that, I'd encourage you to check out the other video on this channel. But for now, I hope this video helps clarify the difference between a psychiatrist and a psychologist. So next time when this comes up in conversation, you'll be able to educate your friends and peers about the difference between psychiatry and psychology. If you found this video helpful, I encourage you to subscribe to this channel to get notified about future videos, and check out some of the other videos on the channel here about all things related to psychology, trauma, and healing.